Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
Which of the following actions indicates that the parents of 12-month-old with iron deficiency anemia understand how to administer iron supplements? Select all that apply. 1. They administer iron supplements in combination with fruit juice. 2. They administer iron supplements with meals. 3. They report dark stools. 4. They brush the child's teeth after administering the iron supplements. 5. They decrease dietary intake of foods fortified with iron. The correct answers are 1 and 4. Parent teaching concerning a child with iron deficiency anemia should include directions about giving iron combined with fruit juice in divided doses between meals and with a dropper for a 12-month-old or through a straw for older toddlers. Iron stains teeth, so brushing the teeth and administering liquid iron through a dropper or straw are necessary to prevent staining the teeth. Iron should not be given with milk and tacids or tea and should be administered on an empty stomach. Iron will cause the stool to become black or green, which is normal and does not need to be reported. However, light-colored stools indicate the iron is not being absorbed and should be reported. A nurse is discussing preterm labor in a prenatal class. After class, a client and her partner ask the nurse to identify again the nursing strategies to prevent preterm labor. The clients need further instruction when they state which of the following? 1. I need to stay hydrated all the time. 2. I need to avoid any infections. 3. I should include frequent rest breaks if we travel. 4. Changing to filter cigarettes is helpful. The correct answer is 4. Smoking in any form is contraindicated in pregnancy, regardless of the type of filtering system used. Smoking is a major risk factor for preterm labor and decreased fetal weight. Dehydration is a risk factor for preterm labor, as is prolonged standing and remaining in one position. Infection is thought to be a primary cause of preterm labor, and the client would need to avoid contracting any type of infection. While taking trips, frequent emptying of the bladder prevents infection and ambulates the woman. A prima gravida client at 34 weeks gestation is experiencing contractions every 3 to 4 minutes, lasting for 35 seconds. Her cervix is 2 centimeters dilated and 50% effaced. While the nurse is assessing the client's vital signs, the client says, I think my bag of water just broke. Which of the following would the nurse do first? 1. Check the status of the fetal heart rate. 2. Turn the client to her right side. 3. Test the leaking fluid with nitrazine paper. 4. Perform a sterile vaginal examination. The correct answer is 1. The priority is to determine whether a prolapsed cord has occurred as a result of the spontaneous rupture of membranes. The nurse's first action should be to check the status of the fetal heart rate. Complications of premature rupture of the membranes include a prolapsed cord or increased pressure on the fetal umbilical cord, inhibiting fetal nutrient supply. Variable decelerations or fetal bradycardia may be seen on the external fetal monitor. The cord also may be visible. Turning the client to her right side is not necessary. If the cord does prolapse, the client should be placed in a kneaded chest or Trendelenburg position. Checking the fluid with nitrazine paper and vaginal examination are appropriate once the status of the fetus has been evaluated. At 38 weeks gestation, a prima gravida client with poorly controlled diabetes and severe preeclampsia is admitted for cesarean birth. The nurse explains to the client that childbirth helps to prevent which of the following? 1. Neonatal hyperbilirubinemia. 2. Congenital anomalies. 3. Perinatal asphyxia. 4. Stillbirth. The correct answer is 4. Stillbirths caused by placental insufficiency occur with increased frequency in women with diabetes and severe preeclampsia. Clients with poorly controlled diabetes may experience unanticipated stillbirth as a result of premature aging of the placenta. Therefore, labor is commonly induced in these clients before term. If induction of labor fails, a cesarean section is necessary. Induction and cesarean section do not prevent neonatal hyperbilirubinemia, congenital anomalies, or perinatal asphyxia. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions. Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following. 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD. The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively. Which of the following instructions should be included? 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing. Which of the following health promotion activities should the nurse include in the discharge teaching plan for a client with asthma? 1. Incorporate physical exercise as tolerated into the daily routine. 2. Monitor peak flow numbers after meals and at bedtime. 3. Eliminate stressors in the work and home environment. 4. Use sedatives to ensure uninterrupted sleep at night. The correct answer is 1. Physical exercise is beneficial and should be incorporated as tolerated into the client's schedule. Peak flow numbers should be monitored daily, usually in the morning. Peak flow does not need to be monitored after each meal. Stressors in the client's life should be modified but cannot be totally eliminated, although adequate sleep is important. It is not recommended that sedatives be routinely taken to induce sleep. Which of following should the nurse perform to help alleviate a child's joint pain associated with rheumatic fever? 1. Maintaining the joints in an extended position. 2. Applying gentle traction to the child's affected joints. 3. Supporting proper alignment with rolled pillows. 4. Using a bed cradle to avoid the weight of bed linens on joints. The correct answer is 4. For a child with arthritis associated with rheumatic fever, the joints are usually so tender that even the weight of bed linens can cause pain. Use of a bed cradle is recommended to help remove the weight of the linens on painful joints. Joints need to be maintained in good alignment, not positioned in extension, to ensure that they remain functional. Applying gentle traction to the joints is not recommended because traction is usually used to relieve muscle spasms, not typically associated with rheumatic fever. Supporting the body in good alignment and changing the client's position are recommended, but these measures are not likely to relieve pain. A mother asks the nurse if her child's iron deficiency anemia is related to the child's frequent infections. The nurse responds based on the understanding of which of the following? 1. Little is known about iron deficiency anemia and its relationship to infection in children. 2. Children with iron deficiency anemia are more susceptible to infection than are other children. 3. Children with iron deficiency anemia are less susceptible to infection than are other children. 4. Children with iron deficiency anemia are equally as susceptible to infection as are other children. The correct answer is 2. Children with iron deficiency anemia are more susceptible to infection because of marked decreases in bone marrow functioning with microcytosis. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant. A client with gestational diabetes who is entering her 3rd trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. A prima gravida client with diabetes at 39 weeks gestation is seen in the high-risk clinic. The primary healthcare provider estimates that the fetus weighs at least 4,500 grams. The client asks, "What causes a baby to be so large?" The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary through an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. A client has been perceiving her roommate's stuffed animal as her own dog at home. The nurse determines that this misperception of reality illusion is improving when the client makes which of the following statements? 1. Jan's stuffed dog looks somewhat like my dog, Trixie. 2. Jan's dog and my dog could be twins. 3. I wish Jan hadn't had my dog stuffed. 4. I guess Jan needs a dog as much as I do. The correct answer is 1. Recognition by the client that there is a difference between the stuffed animal and her live dog indicates that the client perceives the reality of the situation. Stating that the stuffed animal and the client's dog could be twins reflects the client's continued misperception of reality. Thinking that the stuffed animal and her dog are one and the same. Stating that she wishes her dog hadn't been stuffed reflects her continued misperception of reality. Stating that the roommate needs a dog as much as she does is unrelated to the client's perception or misperception of reality. Which of the following is an expected outcome of pursed lip breathing for clients with emphysema? 1. To promote oxygen intake. 2. To strengthen the diaphragm. 3. To strengthen the intercostal muscles. 4. To promote carbon dioxide elimination. The correct answer is 4. Pursed lip breathing prolongs exhalation and prevents air trapping in the alveoli, thereby promoting carbon dioxide elimination. By prolonging exhalation and helping the client relax, pursed lip breathing helps the client learn to control the rate and depth of respiration. Pursed lip breathing does not promote the intake of oxygen, strengthen the diaphragm, or strengthen intercostal muscles. A client uses a metered dose inhaler to aid in management of asthma, which action indicates to the nurse that the client needs further instruction regarding its use. Select all that apply. 1. Activation of the MDI is not coordinated with inspiration. 2. The client inspires rapidly when using the MDI. 3. The client holds his breath for 3 seconds after inhaling with the MDI. 4. The client shakes the MDI after use. 5. The client performs puffs in rapid succession. The correct answers are 1, 2, 3, 4, and 5. Utilization of an MDI requires coordination between activation and inspiration. Deep breaths to ensure that medication is distributed into the lungs, holding the breath for 10 seconds or as long as possible to disperse the medication into the lungs, shaking up the medication in the MDI before use, and a sufficient amount of time between puffs to provide an adequate amount of inhalation medication. The nurse should teach the client with asthma that which of the following is one of the most common precipitating factors of an acute asthma attack? 1. Occupational exposure to toxins. 2. Viral respiratory infections. 3. Exposure to cigarette smoke. 4. Exercising in cold temperatures. The correct answer is 2. The most common precipitator of asthma attacks is viral respiratory infection. Clients with asthma should avoid people who have the flu or a cold and should get yearly flu vaccinations. Environmental exposure to toxins or heavy particulate matter can trigger asthma attacks. However, far fewer asthmatics are exposed to such toxins than are exposed to viruses. Cigarette smoke can also trigger asthma attacks, but to a lesser extent than viral respiratory infections. Some asthmatic attacks are triggered by exercising in cold weather. When developing a plan of care for a newly admitted 2-year-old child with a diagnosis of Kawasaki disease, which of the following should be the priority? 1. Taking vital signs every 6 hours. 2. Monitoring intake and output every hour. 3. Minimizing skin discomfort. 4. Providing passive range of motion exercises. The correct answer is 2. Cardiac status must be monitored carefully in the initial phase of KD because the child is at high risk for congestive heart failure. Therefore, the nurse needs to assess the child frequently for signs of CHF, which would include respiratory distress, and decrease urine output. Vital signs will be obtained more often than every 6 hours because of the risk of CHF. Although minimizing skin discomfort would be important, it does not take priority over monitoring the child's hourly intake and output. Passive range of motion exercises will be done if the child develops arthritis.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.